Hello, everyone. It's Monday, November the 23rd, and I've got lots and lots and lots of more deaths to read to you. 28 more since last Friday. You know, that it ought to get every single one of our attentions, because, we all know what's going on across our nation. Still in West Virginia, we are still producing really good numbers compared to the nation, but these numbers don't mean anything to these families. These families that have lost loved ones, they don't care about a number. And so please remember all these people in your prayers, your thoughts, especially over this Thanksgiving period that we're about to enter into. So I don't know what else to say other than you got a lot of people out there that are trying with all in them to try to slow this down. And at the same time, our nation is really, truly suffering with this pandemic, and it is whiplashing us in a big way. Today we have 28 additional deaths in West Virginia, and bringing the grand total to 667 deaths. Our 640th death is a 61-year-old male from Fayette County. Our 641st death is a 74-year-old male from Summers County. Our 642nd death, a 66-year-old female from Logan County. Male from Logan County. Our 643rd death, a 90-year-old male from Nicholas County. Our 644th death, an 80-year-old male from Marshall County. Our 645th death, an 80-year-old female from Cabell County. Our 646th death, a 79-year-old male from Cabell County. Our 647th death, an 89-year-old male from Cabell County. Our 648th death, a 62-year-old male from Wood County. Our 649th death, a 63-year-old male from Harrison County. Our 650th death, a 91-year-old female from Harrison County. Our 651st death, an 85-year-old female from Kanawha County. Our 652nd death, an 85-year-old female from Kanawha County. Our 653rd death, a 92-year-old female from Harrison County. Our 654th death, a 69-year-old female from Mason County. Our 655th death, an 83-year-old male from Putnam County. Our 656th death, an 85-year-old female from Mason County. Our 657th death, a 96-year-old male from Wetzel County. Our 658th death, an 88-year-old male from Morgan County. Our 659th death, a 91-year-old male from Mineral County. Our 660th death, a 72-year-old male from Mineral County. Our 661st death, an 80-year-old male from Mineral County. Our 662nd death, a 60-year-old female from Summers County. Our 663rd death, a 66-year-old female from Kanawha County. Our 664th death, a 71-year-old female from Kanawha County. Our 665th death, a 79-year-old male from Berkeley County. Our 666th death, a 75-year-old male from Wyoming County. And our 667th death, a 72-year-old male from Summers County. Oh, me. I hate this. I hate it so bad. And I pray so much that you'll be with these families and you'll think about them and you'll send up many, many prayers for them. At the same time, I pray so much that someday very soon that we're going to have that vaccine, and hope and pray that it works, and hope and pray that some way, somehow, this terrible, terrible killer can come to a halt. In the last 24 hours, really and truly, our numbers, have gotten a little teeny bit better. Our daily positive rate has dropped to 4.00. Our cumulative positive continues to rise. It's at 3.48. Our active cases are up to 13,678. The recovered cases are 26,769. We have a record high number of patients that are hospitalized at 463, and a record high now of patients that are hospitalized in the ICU of 136. This weekend, we tested almost 40,000 West Virginians. Now, think about this. West Virginia's population is 1,700,000 and change. And we have now tested 1,033,510 tests. Today, our reproductive rate, RT rate in West Virginia is 1.09. It's the 23rd best in the country, still just a little better than midway, but it's still surely not anything close to as bad as it was. On our map, on our DHHR map, we now have 5 counties in the red: Marshall, Brooke, Mineral, Berkeley, and Wirt counties. We have 18 counties in the orange. That's Hancock, Ohio, Wetzel, Barber, Preston, Grant, Hardy, Hampshire, Jefferson, Ritchie, Wood, Jackson, Mason, Putnam, Wayne, Mingo, Boone, and Wyoming counties. Before I go off of West Virginia, let me just say just this. How can we make this thing better? What can we do? What ammunition do we have? What can we do? An alternative is shut stuff down all over the place. Stay-at-home orders and shut down, and people losing jobs, and all the just collapse of economies and everything else under the sun. And we don't want to do that, do we? We don't want to do that at all. The only other thing we've got, the only other bullet in the gun right now is your mask. We're testing and we're doing our testing. We're testing aggressively now, and that's really good. And we're trying with all in us to do the contact tracing and to identify the people that are spreaders and the people that are asymptomatic and don't have a clue that they're spreading this and everything. And that is helping, and it's helping unbelievably. It may not be enough. We'll get to that later, but nevertheless, I would tell you to continue to test, and I would tell you with all in you to wear your mask. Wear your mask, please, please. These are the only bullets in the gun right now other than sending everybody to the house. We sure don't want to do that. And our numbers are so much better than our surrounding states and other people and everything all across this nation. We don't see a need to have to do that right now. Now, with all that, I want to just say just this. I want to say that we continue to take information and look for knowledge in every nook and cranny. And so as we do that, it may very well be the recommendation from our medical staff and medical experts and advisors, National Guard and DHHR and all of our people, that we take a pinpoint selection, a specific county, and we may have to look at doing other modifications in a specific county in trying to slow this thing down. Everybody's trying. In our nation, we have more than 3 million new COVID cases that have been reported from November the 1st to November 22nd. Think about it. What did I just say? In this nation, we have more than 3 million people that have been reported in the last 3 weeks that have reported positive. That's a quarter of all the U.S. cases since the beginning of the pandemic. Now think about that. We've been going at this a long time. We've been going at this since the last days of February, the first days of March. We've been going at this. This is going to get to the point in time where we've been at this for a year. We've been at it for a good 3/4 of a year right now. Think about this. In the last 3 weeks, we have had a total number of cases in the United States equal to 1/4 of all the whole time period. As of Friday, the number of daily new cases has increased 25% compared to the last week. So now, in addition to that, we're jumping at 25% a week. The number of new tests increased, by 14% across the nation. Approximately now we have 83,000 COVID patients that are hospitalized in this nation. That's the 12th straight day in the U.S. that we have broken records, a new record for 12 straight days is the number of people that are hospitalized across this nation. The CDC has put out travel advisories and everything, asking people to really look at postponing their travel or whatever, and we tell you over and over, as far as Thanksgiving, we want you to be with your families, that's for sure. It would be much, much, much better if you were with the family members that you're with all the time and maybe looked at postponing, some travel, of sons and daughters or grandkids or whatever it may be that are, that are across this land. But we depend on you to be able to make those decisions too. You see, our people are smart in West Virginia, and we absolutely depend on you to be making good decisions, that will just not make this situation worse and worse for your family and worse for all those you love the most. We know our face covering mandate or executive order is in place. We absolutely want you with all in us to wear your mask, especially as you go in a public building of any kind, business, private, public, it doesn't matter. Absolutely, we want you to continue to try to do the right things as far as social distancing and washing your hands and on and on and on. Please be super careful at church, and anybody that needs a sign, for your business and everything, you can call us and we'll get that to you. But we need you to try to step up, and from the standpoint of businesses, try to help us encourage people to have those masks on, please. Again, I want to encourage all West Virginians to get tested before Thanksgiving. If they're going to spend time with loved ones, please try to do that. The free testing maps are up there, and as an effort to ramp up our free testing opportunities for all West Virginians, DHHR and the National Guard are working with our local health departments to offer free testing events all across the state. You'll be able to see it and follow it now. I've told you about our drive-through pharmacy stuff over and over, and we appreciate them so much and everything for stepping up and all the good work that they've done and helping us be able to test these people. On Saturday's education map, it was updated it was updated yesterday because several more counties turned red. On the education map, we had 9 red counties: Marshall, Mineral, Hardy, Berkeley, Wood, Ritchie, Wirt, Brooke, and Jackson counties all turned red. 10 counties were orange: Ohio, Hancock, Hampshire, Jefferson, Mason, Putnam, Cabell, Wayne, Boone, and Wyoming counties. There's 12 counties in the gold, and the following counties have decided to move to full remote learning and voluntarily entered into the red designation, and that's Wetzel, Grant, and Hampshire, Upshur, Clay, and Nicholas counties as well. Our schools continue to be, in their own way, a safe haven. We have 25 outbreaks in our schools. We have 90 confirmed cases at this time in our public schools, and there's more information up on our websites in regard to that. We have 101 outbreaks in our long-term care facilities. Our churches, we have 22 outbreaks in 16 counties now. Those counties are Berkeley, Cabell, Fayette, Jackson, Kanawha, Logan, Marion, Mingo, Monroe, Preston, Raleigh, Taylor, Tyler, Wayne, Wood, and Wyoming counties. Again, I can't say it enough. If you're elderly, you may really need to be thinking really hard about whether or not you should be attending church services at the church. Maybe be able to get your church services online. Absolutely, there's so much that can be done there, but if you decide to go, please, a pew in between, wear your mask, please try to remember to wash your hands. We're close to that vaccine. And if you're close to being able to have something that will save your life, for crying out loud, just think really hard about what you ought to be doing. A corrections update: the situation has improved tremendously at Stevens because of the great work that everybody's doing there in McDowell County. Everybody but 13 of the infected inmates have now recovered. Remember, that number shot, I think, to 260. The same is true for all but 7 of the staff. Stevens had a total positive of 266 inmates and 47 staff during this outbreak. Outside of Stevens Corrections, Corrections has 20 inmate positive cases and 27 staff cases throughout the state. Those inmate cases include 9 at Northern Correctional Facility and 5 at Denmark Correctional Center. The current staff cases are scattered throughout the DCR, system, and so no point in me going through all that. Just another reminder about the flu vaccines. We're up just under 190 million that's gone out to our cities and our counties. We continue to ask them to continue to apply, or this 190 million, or right just under it, has been awarded, and it's getting pumped out to these cities and counties, and I know that's provided incredible relief and great work to our cities and counties. Of all things, today, just like every day, today is National Public Health Thank You Day. Really and truly. Every day ought to be National Public Health Thank You Day. Every year on Monday before Thanksgiving, the nation takes time to recognize the public health workforce who labor tirelessly every day to protect us from disease, injury, or health threats. Today, I want to extend my thank you to all the health workers in West Virginia, but let's stop. That's just a written statement. Bottom line is just this. Think of the people that are protecting you. Think of the risks they're taking. Think of their courage. Think of the fact that every day they're crawling up out of the bed, putting their clothes on, and going right in the middle of the fire for all of us. It ought to be a National Public Health Thank You Day every day. And so for them all across our land, thank you so much. Thank you so much for all you do. all you've done. We continue to pray for you, and thank you again. I do plan to have the briefing again on Wednesday, and at that point in time, we will not be back with you until the following Monday, except unless there's really problems or whatever it may be that I need to come and be with you, because I'll surely be working as well as everybody else, and nobody will be slowing up on this. I've got one thing that I'm ending with purposely. I want to read this to you and everything, but today we need to celebrate the work and the life of a great man in great West Virginia, a great American, a great patriot, someone who served our nation and this state and my administration. And absolutely, I am so proud to tell you today that we're announcing the transition of General Hoyer as part of the next 4 years of my administration. General Hoyer has spent 40 years in uniform. He doesn't look it, but he's 109 years old now. No, I'm just teasing. But he spent 40 years in uniform and almost 10 years as our Adjutant General of the National Guard. He and his wife, Amy, have spent their entire life together in military service. They have 2 sons, one who serves as an NCIS agent and one who's full-time in the National Guard. The General and I had this discussion recently, but we had this discussion as well a good while back, where he expressed his desire to retire from the uniform, but he wanted to continue to serve the state. He said he wanted to continue to work with me to move our state forward, but in a different role. He also told me he wanted to continue to be part of my leadership team leading our state COVID response and preparing for vaccine distribution. I agreed that we would develop a plan for him to play a key role for me, but in a different status. Many of you know that General Hoyer was also a key part of my team that helped convince Hyperloop to come to West Virginia. And we need his leadership to move forward with Hyperloop as well. You know, Hyperloop gives us opportunities beyond belief. Our general has also been a leader in our efforts to repurpose surface mine sites and leverage the capabilities of the coal industry to give us other opportunities in the national security field. I want to continue to grow these opportunities, these defense opportunities as well. So, what did we do? You know, the general is relocating to Morgantown. I think he'll tell you in a few minutes, how that works with his family so much better. So we worked with Dr. Gee at West Virginia University to establish an opportunity for General Hoyer to continue his work with me and my administration and do great work with Hyperloop and many, many, many other projects, as well as our coal industry and our surface mine development of national defense, possibilities and on and on. General Hoyer, very happily, I am saying now, because I know this is what he wants to do in his life. General Hoyer will serve as a senior associate vice president at WVU as he carries out these duties. He will be the leader of our joint interagency task force on vaccination. He will continue to be a key member of my COVID advisory team. He will also help me work important economic development projects such as Hyperloop. He has and continues to be a great friend, a great leader, a great person for the state of West Virginia. And Kathy and I are excited for him and Amy and their entire family as they enter a new chapter. And our general continues to serve me in this great state, and I could not be happier. I could not be more honored. In addition, with General Hoyer's full recommendation, I am now appointing Brigadier General Bill Crane to serve as the new Adjutant General and lead our West Virginia National Guard. This transition will occur on January 4th, 2021. At this time, with great, great pleasure, I give you General Jim Hoyer. What a man. Great, great man.
Thank you, Governor. Thought this was going to be easy, but I think it might be a little bit more emotional than what I thought. Governor, I remember specifically 3 meetings that I've had with you over the past 4.5 years, even before you were governor. And the first one was in your office in Greenbrier County and I remember it because I have great respect for both Coach Nealon and Coach Pruitt, and you were with them, and you had asked me to come down and talk about what can we do to take care of the people of West Virginia impacted by the 2016 flood. And I remember you looked at me then and said, what do we do? We have got to take care of the people of West Virginia. I remember the meeting the night that you called me to the office on a Sunday evening to take responsibility for the RISE program. And you made the same statement. We've got to take care of the people of West Virginia. And then a couple of Sundays ago, late one evening, in a discussion, I remember you saying, Hoyer, I love you like a brother, but we got to figure out how to do more. We've got to get a hold of this. So, Governor, I plan on taking both of those things and just letting people know while I may be changing uniforms, my intent is to still be with you to take care of the people of West Virginia and figure out how to do more. Almost 40 years in uniform. Next spring, I turn 60. That's the mandatory retirement date for a general officer without a waiver. And as I thought about it, and Amy and I talked about it, and the things that were going on that we're dealing with from a leadership standpoint, I felt it would be most appropriate to come to you and say, I think it's time for me to go ahead and step out in uniform, let somebody else focus on taking care of the soldiers and airmen of the Guard day to day, so I can focus with you on pandemic response and vaccine distribution and those economic development opportunities that you talked about. So, I can't ever thank you enough for the confidence that you had in me and Amy to lead the Guard, but more importantly, to be a part of the team doing great things for West Virginia. Again, I'm not leaving. I'm not leaving the pandemic, press events. I'm not leaving the leadership team. I'm just changing uniforms. Thanks to you and Dr. Gee for giving me the opportunity to work that out. My youngest son lives in the Morgantown area. Our oldest son, hopefully in the next year and a half, will be moving back towards DC or Pittsburgh in his role with NCIS, and it allows Amy and I to be closer to our kids. She's got a great opportunity as a nurse with West Virginia University as well. And I appreciate you allowing me to continue to be part of your leadership team, just in a different role. And my commitment to you is we will continue to take care of the people of West Virginia, and we will figure out how to do more. Thank you very much.
Thank you, sir. Thank you so much. I can never thank you enough for your friendship, and I can never thank you enough for what you've done for this great state. There's a real hero, everybody. And honest and Pete, if anybody doesn't believe that, they're out of their mind. But that's a superstar and a real hero. That's all I've got, guys.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar. Well, thank you. And for my first comment, I want to thank and recognize General Hoyer for his selfless service to West Virginia. You know, being a bit behind the curtain with the leadership team, I understand the incredible work and leadership that the general provides the state of West Virginia every day. And I have to say that I'm also grateful that the general will be maintaining his role with our leadership team and the COVID response, the vaccine distribution plan. But I'm also very excited about him joining us in Morgantown as well. So Jim, thank you for everything you've done. It's really an honor and a privilege to get to serve with you. And thank you for all the work the Guard has done through your leadership. I'm going to be really short today. The governor has covered things really well. You know, in the United States, we've had 20 days of having over 100,000 new COVID cases per day. In West Virginia, we're approaching 1,000 COVID cases per day. The governor said we have an all-time record for hospitalizations in our country. We're coming up on 100,000 hospitalizations. Our cases are rising, and our deaths are rising as well. And you know, we talked about the very beginning of the pandemic, the idea of this hammer and dance concept, which is when the pandemic first started and we had fewer capabilities to test and to treat, then, you know, stay-at-home orders more globally were what people did to, including West Virginia, and I think did to protect people, and I think that was smart at that time. At this time, though, we have more tools, we have more testing, and people are doing an amazing job doing the testing, contact tracing. But as the governor said, there comes a time when we start to see those infection rates, as we've done, go up, you know, close to, you know, 100 people per 100,000 being on the, you know, 7-day rolling average being the active new diagnosed cases every day. And in Mineral County, we are seeing close to 200 per 100,000 population. Most of the northern panhandle close to 100 per 100,000 population. And the infection rate going up is not really limited to only the red counties. We're seeing that happen in orange counties and even in a few counties certainly over that 25 per 100,000, which is the top of our infection rate threshold. And what that tells us is that despite all the testing and despite all the contact tracing, that in some areas COVID is spreading fast enough that perhaps, you know, some focused and precise strategies will need to be done. This is certainly the governor's, you know, his leadership and his decision, so that we can start to reduce the spread of the disease, reduce the input of the spread. And we know that, you know, certainly places where people take their masks off, you know, indoor restaurants and bars and gyms and coffee shops are places where we have seen spread and where others have seen spread around the country as well. And I know the governor will have to take everything into consideration to decide what to do. But as he said, and I will finish with this, that we do have very powerful tools in our tool belt, but those tools don't really work very well unless we use them. And those tools are really making smart decisions around travel and gatherings for Thanksgiving and for the holiday season coming up, wearing your mask, physically distancing, getting tested, avoiding crowds, avoiding closed indoor environments, particularly where you have to take your mask off, and avoiding close contact with people that you don't live with all the time. And CDC reminds us that that is 15 minutes cumulative time in a 24-hour period of time with or without a mask on. So less than 6 feet, 15 minutes cumulative over a 24-hour period from somebody who's developed COVID-19 will give you the risk of developing it, and by contact tracing definitions would ask you to quarantine. So lots of hope is coming. Vaccines, new drugs, the new Regeneron drug was just approved by emergency use agreement, which is an antibody treatment, which is like the Lilly drug. And the vaccines are undergoing emergency use authorization assessment by the FDA, particularly Pfizer right now, and we presume Moderna will follow, and then probably AstraZeneca will follow that. So lots of light at the end of the tunnel, but West Virginia, in order to get us there safely, we really need to call on you, particularly during this holiday season, to be very, very smart and to be very diligent at protecting yourself and protecting each other. So thank you so much.
All right, thank you, Dr. Marsh. Next to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. I did want to touch on a topic that we get a lot of questions on, church outbreaks and singing in churches. We currently have 22 church outbreaks in the state of West Virginia. And as a public health measure and something that our faith leaders in multiple churches in the communities have brought to our attention, we do not recommend group singing in churches at this time. Some alternatives that have been suggested to us that other churches are using: if you can't go online, for your services for singing in churches, you can have one single singer at the front of the church. So that's one option. You can have small singing church groups, 3 to 4 people with a plexiglass barrier. Some churches have reported using pre-recorded music that's being played during services. So those are some alternatives rather than having an entire congregation singing. But those have been brought to our attention, and those are suggestions by some pastors that I have spoken to across different faith-based leadership groups. Masks are recommended. In churches, worn car to car. Those have also been suggested. But to maintain social distancing, continue hand washing, because we do have 22 church outbreaks in the state of West Virginia right now. Thank you.
All right, thank you, Dr. Amjad. Next to Bill Crouch, Secretary of the West Virginia DHHR.
Thank you. First, I want to also congratulate General Hoyer. His retirement from the Guard and transition to a different role is terrific from the standpoint of his leadership and his role with DHHR. I couldn't ask for a better partner with Jim Hoyer and Clay Marsh. It has truly made this workable. And I thank the governor for putting that team together and keeping that team together, because it's working. We're doing well as a state. Let me add to, just for a minute, to what the governor said with regard to National Health Thank You Day. This is the first Monday before Thanksgiving. Every year, I just want to mention that especially thank our local health departments, our local health officers. The staff of those offices work every day in our communities to keep people safe. They are unsung heroes in West Virginia. And I also want to thank our public servants in DHHR, our Bureau of Public Health, our epidemiologists, our data folks, our communication people, DHHR's Health Command, all working together to get us through this pandemic. We also have a large number of folks from other bureaus and other offices in DHHR who are stepping up and assisting with public health folks in this pandemic, and are in essence have become public health folks. So you may never know their names, but they are heroes in this state. So please join me to honor those public health professionals who work tirelessly every day to protect the health and well-being of West Virginians. Thank you.
All right, thank you, Secretary. We'll now go to questions from members of the media. The first today from Steve Adams with Ogden Newspapers.
Yes, Steve Adams here with Ogden Newspapers. I don't know if this has changed any since before, but I had been told that there had been some emails going out to some state employees, specifically talking about moving people to those that can work from home to continue to do so. My question is, I'm assuming, and you can tell me if I'm wrong, do state agencies still kind of have that flexibility to have employees work from home, or are there specifically directives being given in regards to trying to encourage more people to work from home when possible, considering the spread of the virus in our cities and counties and communities? Thank you.
Stephen, I can take that and answer that real quickly and everything, and just say that all the secretaries have been empowered by us to let have the people work in the most efficiently and the most safe way they can. And I stand behind if they choose that they can allow certain people to work at home and get the work done and all that kind of stuff. I think we've empowered them to make those decisions, and we expect them to do so, and we think they're doing that.
All right, thank you, Stephen. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, you mentioned pinpointed measures in select counties. Could you talk about where do you start with that? And then maybe the healthcare experts could tell us, when do we know we've reached the point that we need to do those pinpointed measures?
Well, Charles, let me just give you, you know me, I don't keep anything from anybody. I just try to tell you the truth as best I possibly can, and that's the way I've been, that's the way I'm going to continue to be. Mineral County is a county that has, I think, in excess of 200,000 positives per 100,000 tests, or 100,000 people. And remember the Harvard map. If you had 25, you were red. And they've got in excess of 200 in a county that's not all that big and everything. And so that's what I'm talking about. It may very well be that in conjunction with the health folks there, that what we may have to do in a situation like that is to go in and try to make some additional modifications to be able to get a cap on this thing. But we're looking at it. Charles, all the health team is looking at everything, and like I've said over and over and over, everything has to always be on the table, because as this thing moves and everything, we've got to be ready to move with it. And just think about this. Days ago, I think it was Friday before last, we came up and said masks have to be mandatory in all of our public buildings. In addition to that day, I said, we got to move the winter sports, didn't I? And since that day, I said, we have to do something with our travel ball and all the stuff we're doing there. Think what's happened since then. A week ago last Friday, 10 days ago, our state has exploded. We made the right decisions on that day. We've made a lot of right decisions as we've gone along, with the goodness of our good Lord looking after us in every way, and so with all that, we're going to continue to try to do just that, but we're working with those counties. We may have to do, pinpoint things to be able to help certain counties and communities and everything, and we're ready to do that. Yeah, sure.
All right, thank you, Charles. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members. I want to be among those who salute General Hoyer, and I'm going to put a picture of my daughter up, Second Lieutenant Allie Curtis, United States Army. Not a day goes by, she's been in the service 3+ years. When I see General Hoyer at the Capitol, the governor's office, here in the TV studio, the very first thing he always asks me is, how's your daughter doing? And he's always checking in on her. He doesn't even know her. She's not even under his command. And that just speaks to what a great man, what a great leader he is. So General Hoyer, congratulations and thank you. And especially thank you for all of the guidance you've given me and my wife and our daughter. Let me ask a follow-up question to Charles's question. When are we going to start seeing some of these targeted guidelines? Could they be today, tomorrow? Some of these counties have obviously spiked, and if you're going to shut down bars or restaurants or gyms or anything in particular, how soon might we start seeing these things?
Mark, let me answer it, and it's just this. Everybody, all the experts, all of us, all the people in my office, everybody is trying with all in us to not shut things down. It's as simple as just that. But first and foremost, everybody is trying with all in us to try with all our capabilities that we have to try, because we're not going to be able to stop this. No matter what we do, we're not going to be able to stop it until we get to that vaccine. But as we continue to try, what I'm going to do, I'm going to listen to the experts, and I'm going to listen and listen and listen. Because, Mark, the biggest thing that could hurt us the most is to be divided. We've kept West Virginia together. West Virginia was the most exposed state in the country. Dr. Burke said it over and over and over, the most exposed state in the country. Because of our age, because of our illnesses and everything, and all of our bordering states, all the population within a rock's throw of us, the most exposed state, and yet we have continued to produce numbers that have been the envy of everybody. Now, we're going to continue to listen to the experts. That's what we're going to do.
All right, thank you, Mark. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Governor, not to be painted as someone who is putting more importance on sports than they deserve. Certainly not focusing only on sports, but a lot of questions have been asked about it from my constituents. So I thought I would ask you and pass along their concern. What is the plan, number one, if Ohio plays again when the Super 6 is scheduled to go on? What is the contingency plan for staging West Virginia's football championships? And then secondly, if you have a moment to touch on this briefly, it seems like you and Attorney General Morrissey have some sort of disagreement over how handling of masks and certain civil liberties and freedoms could be interpreted. Could you touch upon where you and the Attorney General are and where you think that relationship is headed? Thank you.
Okay, Kenny, you're going all across the spectrum. I'll try to do the first. Okay, as far as the football playoffs, you know, we've all got to realize just this. I say it over and over. I mean, I love our kids, and I love sports, and I love how hard these kids work, and I love how much it brings communities together. And I mean, I go back to the coal fields years and years and years ago when I had really brown hair, you know, and all the different little coal field communities had ball teams, especially baseball teams, but they had everything. And that was the fabric of that community in many ways. But we got to remember just this. We're dealing with something that nobody's dealt with before. We're dealing with a pandemic, and school has to take precedence over sports. And if we can't go to school, and it doesn't make any sense to go to school, it really doesn't make much sense to be preoccupied and worried to death about sports. Right now, some way, somehow, life will go on for these young people, and life will go on for our communities and everything else. We absolutely are looking and in constant contact with the education people. They're advising. The SSAC is advising. You know, we're looking at, you know, from the standpoint of, is this county or this county, you know, where's the county that's the safest? What is the very best for us to do? There's a lot of different balls to juggle. That's all there is to it, and to really try to make the best of the situation that we can make. Now, I hope to goodness that we'll get our fall sports done, and then we will look at our abilities to try to do everything we possibly can to be back in school and be able to have our winter sports at some point in time. Right now, January the 11th looks really tough to me. It just, you know, we may have to shove that out even further. But nevertheless, we're looking. And I think, Kenny, your other question was in regard to the, if you do that one more time, I think it was in regard to the Attorney General, is that correct?
Yes, sir. I was asking, number one, do we have a plan for a backup for for the Super Six if Ohio County can host it. I don't know if I got an answer clearly in that. But the second question was about you and the Attorney General. He put out some stuff on social media about civil liberties and freedoms, and it seemed to target some of your orders about wearing masks and mandating it. And I was just wondering if you guys have had conversations and where you are right now on that.
Well, Kenny, first of all, I'll be talking to Bernie and the SSAC people later today and through our education people and everything. And maybe the best way for me to have those conversations is that, but I have conversations nonstop with all these different agencies, and we'll make the right decision. I don't think we've got a decision, right at this time on our Super Six and everything. But again, there's a lot at stake here. A whole lot at stake, and stuff at stake that really supersedes sports and supersedes lots of stuff. So we got people dying right and left, and we got to really attend to that. In regard to the Attorney General, Patrick and I are friends. We're going to remain friends. Whether or not I was disappointed, I was damn disappointed. That's all there is to it. There's no other way to say it. I have supported Patrick and the Attorney General in every way I possibly can. And I think it's a crying shame that he may have overlooked the severity of this situation. Dividing us is basically what we're really talking about here. That's the last thing we need to be doing right now, especially when almost 90% or maybe even greater than that, 90% of the people out there believe we ought to be wearing a mask. We ought to be wearing our mask. I mean, if I've said it over and over, it has nothing to do with our constitutional liberties. It has nothing to do with taking our guns or whatever it may be. It has one thing and only one thing to do with, and that's just this. If you want to just walk over a cliff yourself, well, more power to you. But you can't be doing something that could possibly cause a lot of harm to others and just do it because, per se, it's your liberty. I mean, what is the difference between driving drunk and saying, well, that's my liberty, or driving down the road at 150 miles an hour because you can't read the signs? I mean, I've said it over and over, we're a nation of laws. I'm not trying to infringe on anyone, but in this situation right now, this mask is the only thing I got. This is all I got to try to help stop this. I'm testing on every street corner almost, and now the only thing I've got waiting on that vaccine is this mask. And to just say, well, people can do whatever they want or whatever it may be like that is not wise. It's not wise to try to divide us. And absolutely, at the end of the day, just think of the millions upon millions, of tens and tens and tens of millions that I'm spending on testing over and over and over and over. Our federal government's spending. It doesn't really matter. I'm trying to look after the store in every way I possibly can. But honestly, it came off to me as even degrading to our police. Our police, they're people that, know how to handle people and get along and everything. There's not police running through the neighborhoods throwing people in jail. You think I'd be for that? There's no way on this planet I'd be for that. But the bottom line, what is the bottom line? And I've said this over and over. The bottom line is just as simple as mud. Are you going to listen to politicians or listen to the experts? You're going to listen to the politicians, you're going to listen to the medical experts. And if this didn't have politics smell all over it, then I don't know my name. That's just all there is to it. Just think, the other day, just as well the other day, I was talking to one of our senators, and we were in a discussion about this, and he said, it's his role to tell people what they ought not do, but it's their liberties to do whatever they want to do. And I said, well, let me make this point. Are you saying to me that someone came to you with leprosy and said that they wanted to go downtown to the daycare center and then they wanted to walk through, whatever school it may be, and then walk through the Capitol, and then they wanted to go to the WVU football game, you'd say, that's their right? And he said, yeah, that's their right. Well, you see, I don't buy that. I don't buy that in any way. I am standing rock solid for everyone's rights. But for crying out loud, in this situation right here, I'm going to be your governor. I'm going to listen to the experts, and I'm going to be your governor. I'm absolutely going to do everything in my power to try to help you and protect you, and surely to God above, not invade your rights. There's no way. There's no way. I stand rock solid for life, for your guns. I stand rock solid for every right that you have. I stand rock solid trying to not close any of our businesses and everything. But this stuff right here, all it does is divide us in playing to some, political deal. Well, I'm not going to listen to politicians. I'm not going to do it. I'm going to listen to the experts.
All right, thank you, Kenny. Next to Paul Mullen with WCBC.
Good afternoon, Governor, and a thank you and a snap salute to General Hoyer for his service, and a good afternoon, panel. West Virginians are kind people, and on Thanksgiving, many of them choose to send a plate of food over to a nearby elderly neighbor. Usually that exchange, you go over, you knock on the door, they invite you in for a couple minutes, you exchange pleasantries, and you drop off the food. Is there a way to do that this year that would continue to have the personal contact at some level, maybe a minute or two in the house? And if you do find a situation where the elderly person is not doing so well, is there a number to call? I don't think you would call 911 because it probably is not an emergency situation, and it probably is going to be on the holiday. What would you recommend? Thank you.
Well, Paul, I'm glad you brought it up because it's something that we got to figure out how to do, and we really need to do. Thank God for our senior services and all the hot meals that they supply and all the incredible work that we've been able to do there. It was a real honor to be able to get them a bunch of new vehicles and everything where they could make those trips better and accommodate more and more meals. But I'm going to let Dr. Amjad answer this because I don't know that I'm educated enough to give a good opinion, but I would say whatever they do, they need to really be on guard and wearing their mask. But nevertheless, Dr. Amjad.
Thanks, Paul. That's a great question. And you're right, West Virginians are very kind, and they do visit their neighbors who don't maybe have the family unit to do the Thanksgiving. So I'll try to answer that the best I can. My first suggestion would be not to enter the person's home, to meet maybe outside on their front porch or something, to definitely wear your mask. My next suggestion would be not to share the home cooked meal you made, because right now we're recommending for Thanksgiving to be celebrated with just the people in your current household. And if you are going to perhaps invite an immediate family member over to, use separate utensils, separate dishes, and so forth. So let's say I want to give my neighbor something for Thanksgiving because she lives alone. I would rather not give her something that I made in my home, even though I maybe made it really clean and really well, because I do not want to give her any of my germs. So I would rather go buy her something maybe that's in the store that maybe she can heat up. And I'm not necessarily suggesting, a TV dinner or anything, but maybe give her something that she can heat up or make herself quickly for Thanksgiving, so that I'm not giving her any of my household germs. I would meet her outside on the front porch wearing masks, make sure we're bundled up so that she doesn't catch cold, make sure we still maintain that 6 feet distance. Let's say that I look at her and she doesn't look well, or maybe I think she's sick, as you suggested, and we don't want to call 911 because we do not want to tie up the lines, or we know that that is not the right thing to do because she's not that sick or she's not having an emergency. But I am concerned. I would probably ask her if I can call her family member or anyone in her immediate family that can come and tend to her, that can enter her home. Maybe she just has not taken her medications. Or I would ask her if she has a family doctor that I can call for her. Most family doctors do have an emergency line or a 24-hour line that they can call during the holidays to get in contact. But that's how I would handle that situation for a neighbor at that moment. Hopefully that answers your question. Thank you.
All right, thank you, Paul. Next, we'll go to Aaron Williams with WBOY.
Hello, Governor. I preface this question by saying that I think everyone agrees that the sooner we can get kids back into the classroom full time, the better. That being said, from the beginning of the school reentry planning, the state has said that there would be virtual learning options open to parents who don't feel comfortable sending their kids to school. Now, Randolph County's Board of Education has voted to end virtual learning for the second half of the school year. I got a call from a grandparent there. He's raising his grandchildren. His family has some health issues. He listens to you, Governor, every time your briefings are on. And he's trying to decide if he should risk sending his grandkids back to school or if he should pull them out of the school system and try to homeschool them. I asked on behalf of that grandfather, do you think that virtual learning should still be an option? And if not, what would you say to him and other concerned parents? Thank you.
Well, again, I don't know how to ever answer something other than just take it on head on. I would say that our education people have tried diligently on the virtual learning, but they and myself will tell you that just this: kids need to be in school. Kids are missing an awful lot not being in school. From the standpoint of what's going on in Randolph, I think you said Randolph County in regard to virtual learning there, and they decided that they're not going to do that anymore and everything. I have not been apprised of that, and I will check on that as soon as we get out of here. But I don't know the details of that. But I will check with Clayton Birch, and I will check with the Department of Education as soon as I get out of here. But the other thing is we have given the counties a great deal of latitude here, in making decisions that they can best make. But from the standpoint of where I'm at, if the kids can go to school, they're tons better off. From the standpoint of their learning and from the standpoint of having additional eyes on them and standpoint of any kind of need that they may have, they're tons better off if they can go to school. Now, but at the same time, we have got to educate our kids some way, somehow. We're dealing with something here. We have almost half of our state in orange and red now. We got to deal with it. We have got to deal with the safety of our teachers, the safety of our kids, the safety of our service personnel. And on the other hand, what happens, to our kids from the standpoint of their learning? What happens to all of our special needs kids? What happens to all those kids that need support and help in every way? I'm telling you, this is a very, very, very difficult balancing act, and all we're trying to do is just get ourselves through this and get to a vaccine as best and as fast as we possibly can. I don't want to say the virtual learning is a wipeout, but I would tell you that the virtual learning is a challenge, and our kids surely have shown, and I am only echoing what our education community is telling me, but our kids have surely shown that they get a heck of a lot more out of it if they're in school.
All right, thank you, Aaron. Next to Phil Kabler with the Charleston Gazette-Mail.
Hello, everybody. Governor, could you comment on the Supreme Court ruling Friday that said the constitutional mandate for the governor to reside in Charleston is not discretionary?
Well, Phil, I will. I'll give you a whole lot more detail on that in the days to come. I'm still doing some, Phil, to be perfectly honest, I've not even read it. you know, and it seems trivial to me. How could anybody possibly have worked more for the last year, especially, you know, how much more can I do in the city of Charleston than I'm already doing? You know, from a standpoint of all the other aspects, you know, I've never, for crying out loud, you know, people may think, well, he goes to the Greenbrier. Are you kidding me? I mean, I have been to the Greenbrier a handful of times. I mean, the Greenbrier did all kinds of redecorating. They built a sports thing down in the casino. I've never seen it. You know, Phil, I work all the time. I've worked every single day for 4 years since I've been your governor and not had one single day of vacation. I don't go places. I just work. And I love my work, and I absolutely work all the time. We'll get into that residency thing and all that kind of stuff, and we'll figure it out. But there's no one in the world that's using our mansion and using, you know, the stuff that we have at our disposal more than I right now. Now, it may very well be that what you want me to do is be a governor, you know, like governors of the past, you know, where you've had a party every other night, or you've flown in the state helicopter every other day, and you've worked from Monday to Thursday, and basically, if you'll just look back at what's been accomplished, you don't accomplish this by just working Monday through Thursday. You don't do that. I mean, really and truly, if you look at what's been accomplished in this state and where we are right now, that's probably the last thing on earth we need to really tend to or worry about right now.
All right, thank you, Phil. Next to Kelsey Soto with WSAZ.
Kelsey Soto with WSAZ. I was just hoping you could maybe touch on some of our testing goals. I know initially there was plans, there were certain numbers you wanted to hit. Are we still doing that? And then obviously we're likely going to see an increase in testing this entire week leading up to the holiday. Any plans to help those labs get those results processed any quicker, knowing that a lot of people, you know, may be meeting with loved ones that live nearby or that sort of thing?
Kelsey, I'm going to pass to Bill Crouch, but thank you for wearing your mask. I see you had your mask on. That's really good. But Secretary Crouch, maybe you could answer this.
Yes, Governor. Yes. Thank you, Kelsey. Good question. We're ramping up testing daily. As you may have noticed on our dashboard, if you look at the 7-day trend, we've hit over 16,000 tests twice in the last 7 days. Actually, on Friday, we had 18,000. So we are, I believe, now 15th in the country in terms of testing. We're doing a great job with that at the governor's direction. We are seeing some slowdowns, some turnaround time slowdowns with some of our labs. And keep in mind, this virus is raging across the United States, and these labs, many of the labs we use, are labs that provide services to other states, many states, if not all states in the country. So the additional testing that's being done nationwide is putting a little bit of pressure on our laboratories. We're still working with some other labs, bringing them on board. We are also working very hard to come up with alternatives to having drive-through lanes. We're looking at testing that can be done at home by the individual. We're looking at drive-through lanes that individuals can test themselves. We're looking at any possible testing that can be done that's safe and approved, that can take the burden off our local health departments and the Guard staff. The Guard has just been phenomenal in stepping up and going out into the local communities and assisting with testing. But manpower is limited everywhere. So we're in a crunch trying to keep testing up with the people we have, the individuals we have, who are all stepping up and all doing a great deal to deal with this issue. Over the holidays, let me mention, everyone needs a little break. We're trying to let our folks have Thanksgiving Day and even more if possible. The Guard's doing the same thing. So we expect to see a little drop in testing over the holidays. That's going to happen, but we will step right back up and we'll pick that up and we'll push as hard as we can. Again, the governor's given us a mandate and we are pushing that to the limit. So thank you for the question. Great question.
All right, thank you, Kelsey. Next to Matthew Young with the West Virginia Daily News.
Good afternoon, Matthew Young with the West Virginia Daily News. I would first like to say to General Hoyer, thank you for, well, sir, thank you for everything. Anyway, I believe this question has been asked before, so I do apologize for repeating it. I just wanted some clarification, if possible. The total number of tests reported, does that include any duplicates or repeat test takers? Meaning, if I've been tested 5 times, do I account for 1 test or 5 tests? So for the the million plus number that has been reported, is that individual tests or just the amount of people that have been tested, be it once or 10 times? Thank you.
Maybe Dr. Amjad, this is yours.
Thanks, Matthew. Our dashboard team does look into repeat testing variables, so they do remove those. However, they do sometimes get into that, but they do try to remove the repeat test takers into that. But I don't know if Secretary Crouch has any more additional information, but they do look at those variables, Matthew, to try to eliminate those duplicate lab tests as well.
Yes, Dr. Amjad, that's right. We do, the tests, the duplicate tests are eliminated if they're done on the same day. So if folks try to go through the testing lanes again to try to get the positivity rate down, please understand those aren't even counted. And that's not what we want individuals to do to game the system. So, but there is duplicates beyond that first day, and we do track those. We're watching those. But I think the question really goes to the total number of tests we've done, which is now over 1 million tests. And those are tests that we've done. You're correct. Those are not an unduplicated count of individuals. We actually mentioned that this morning, had a discussion about that this morning. We're going to try to track those a little bit better. Again, our focus is on getting people tested. But the fact that the governor has ordered nursing home staff to be tested twice a week, those numbers are going to increase, and they're going to have more and more duplicates. So because of that, we're going to focus a little bit more on those duplicates and may have more information for you in the next week or so about those numbers. So great question. Thank you.
Thank you, Matthew. Governor, I'll turn it back to you.
Well, I'll just end by just saying 2 or 3 things real quick. One is West Virginia, this is a battle. And if you don't think we're not all in this together, you're not thinking clearly. This is a battle that we've got to win, that we will win, but it is absolutely a battle that we've all got to be in, being together. From the standpoint of wearing your mask, sure, I can't stand it. But if it's from the standpoint of having to give a little, just from the standpoint of, you may not think it matters, you may not think that it absolutely matters whatsoever, but it does. All the medical community in all the lands says it does. But if you don't think that it matters at all, that's okay. That's okay. But what if there is any chance that it does? I know it's an inconvenience and I know it's a frustration. But please, for all of us, wear your mask. Wear your mask. You may be you may be a little frustrated, a little inconvenienced. At the same time, you may very well save some lives. Just please know that we're all in this together. I'm right with you. I'm right with all the West Virginians. We're in this together, and we're going to get through it together. And if we divide our house, we'll never make it. Or we may make it, but we'll lose a lot more people. Now, the last thing I'm going to say today, though, is, again, General, it has been a real honor, a real honor flying with you. I want to continue that honor for years and years to come, especially for the next 4 years, and we've decided we're going to do that. I know you're going to do just absolute superstar things there, but I can never, ever thank you for what you've already done. I mean, it is unbelievable. The mud we've tromped around in the floods, the derechos, the everything that I've seen you in action on, that's before I became your governor. Absolutely, the flood was before I became your governor. I have seen how you have responded through all this pandemic. I have seen how you've responded to help getting our kids fed and helping all throughout all of our state in every way. You are a hero, and it has been a real honor flying with you. Thank you, sir. God bless you.